I would kindly ask you to stand up. Thank you. Now stretch a bit yourself. Just try to feel your muscles. You know, there are legs, we have arms, we have shoulders, we have backbone. We were sitting here for an hour and a half, and we are not just mind, we also are body, and they have the rest now, and thank you. Please sit down. Try to some blood. My name is Borut Kirn, and I do research in cardiovascular physiology, and this short exercise is probably today the most I can do for you and for your cardiovascular system. I'm presenting here a project Primarius, which is a missing link, a link between the hospital, the doctors, and the patients after the patient goes home. And maybe you are wondering why I'm working and presenting communication aspect between the doctors and the patients while I'm working actually in the hard science. Well, the story goes like that. We were doing research in the medical faculty in Ljubljana, collaboration with Maastricht University, and we were really improving techniques how the patients were treated after some event. And we were successful. We were able to reduce fatal events in many patients. These patients survived, and they became chronic patients. And the more effectively that we were working, the more patients survived, and the more there were chronic patients. After a while, we started to think, well, you know, the treatment itself, just to save the patient, costs, for example, the pacemaker costs 20,000 euro to implant it. And then the lifespan of chronic patients and the costs of that can be multiplication of this value. And then we would start to think, well, we invest our creative work in helping people, but are we thinking really broad so that the system, the health system, will survive when I will need it? So in 10 years, maybe 20 years, is it still going to be there, or the sheer costs will just rise so high that it won't work anymore? And we started to think, well, what are the needs of chronic patients? How can we study that in addition to the studies of high tech in the medicine? And imagine a patient with infarction treated in the hospital, and then when he goes home, he's a chronic patient. What does she or he need? Well, to optimize, they need to change lifestyle. They have to learn a lot from the previous generations, experienced patients. They have to address their worries. They have to avoid depression or anxiousness, serious problem. For all these 4 things, and there are more, it's very difficult because it takes a lot of motivation to achieve it. And when do the patients have the largest motivation? At the moment when they leave the hospital. And then couple of days, couple of weeks, that's where the motivation is. Great, we found out that's the motivation. And the next question is, do they have the right information at that exact moment? And I would like you, when we came to the core of the problem, I would like you to recall a situation from your experiences when maybe your grandmother, grandfather, or some relative came from a relatively serious event from the hospital home, and you asked him, what did the doctor tell you? What do they answer? Not much. Not much. The answer is very little because, of course, patients forget. They forget up to 85% of what they are told. They forget because they're overwhelmed with all the information in the hospital, and by the time they come home, when they would really need this information, they don't have it. What do we do? Well, we can call the doctor, which treated us, and look, we want from that doctor to be the high, top, professional, skilled, and we want him to understand all the studies, and we are asking him something that we forgot again and again and again. Doesn't work well. We can ask our friends. We get information. Different types. We can go on internet. We get a lot more information. We get confused. We can do nothing. Not good. And very often what happens is that people get angry on the health system despite they were treated fantastically, because at the moment when they need the information, they don't have the information. To solve this problem, we developed the platform Primarius, which works like that in the hospital, the patient, upon leaving, receives a voucher, a code, anonymous code. Please, just pass it around. And this code, he or she can distribute when he comes home to friends, to family, and they all can see the content which is on internet. There are recordings pre-prepared of the doctors, of the very top doctors, which give the instructions, explain, and that is a passive contact between the patient and the doctor without additional efforts required for the doctor, different additional loads for the doctor or for the hospital. And what is even more important, perhaps, is that because doctors give academic explanations, patients need in their language. So the best way would be that the other patients tell them their experiences and their tricks how to cope with life from now on. And that's what we are integrating in this platform, so that the best practice is further spread among the group of the patients. At the present, we are running a pilot project in collaboration with the University Clinical Center of Ljubljana and with coronary club of patients in Ljubljana, and with this we have idea to go further and to spread, to extend our project to other clinics in Slovenia and in the Netherlands. So next time, when you will have contact with somebody coming from the hospital, don't ask them, what did the doctor tell you? We know what has happened with this information. Just ask them if they would be ready to share the code with informations, the Primarius code, with you. And if they don't have this code, they didn't get it in the hospital, well then ask yourself what is really the interest of the hospital, that they don't address this basic need. Okay. Thank you.
Thank you. Dr. Kirn, do not leave the stage. Now, you're a doctor and you're a scientist. Is that correct? Yeah. So,
I'm not a doctor. I have a PhD, but
yeah, okay.
Not a doctor, medical doctor.
You have a PhD.
Correct. Okay.
You have a PhD. How come that somebody with a PhD thinks of something so logical? How come that you found out something so normal?
It takes time to get rid of something that you were taught.
Uh-huh. So also people with PhD can possess common sense.
Hopefully.
Okay, thank you very much.